And welcome back to the Morning Blend. Well, millions of Americans suffer from chronic sinus problems. Our next guest is one of them. He's suffered for years, but here's the twist. He's a surgeon who specializes in treating those exact same problems. The doctor, in this case, is also the patient. So what did he learn from his experience, and how has that changed the way that he now cares for his patients?
Dr. Madan Kandula is with Advent, Advanced Ear, Nose, and Throat Specialists. And recently, you had all these done on yourself. I just think that's amazing, because it's like, what on earth? This is what you generally do for other people.
Sure.
So walk us through exactly what you did as a surgery that you needed to do.
Yeah, so what I ended up having done was pretty much all the things that we always talk about is what I had done. So I had a deviated septum, so I had that straightened, so it's called a septoplasty. I had my turbinates shrunk down, which are those humidifiers that are always, we were talking about them being big. Those guys shrunk down. Sinuses open, and actually I had a kind of a combination sinus surgery, so a more traditional sinus surgery, and then on one set of sinuses, the balloon sinuplasty that we always talk about. And then the final thing I had done was I had my tonsils out, so I just threw that in for fun.
Yeah, just like, hey, take my tonsils too while you're at it.
While you're there.
Yeah. What, these are procedures that you always do yourself, and now you find yourself as the patient. So I guess the one question everybody's going to want to know is, do you feel better?
Absolutely. Yeah. I mean, I'm 2 months out right now, and I feel, night and day different already. So my big issues that I had, everybody's different with their particular, situations, but my issues were just congestion. So my nose was stuffy, and it was just getting annoying, and the things that I was using just weren't doing the trick anymore. Rinses and nasal sprays and all that sort of stuff. So they helped in the past, but they just kind of ran their limit. And then the other thing that started in probably 6-7 years ago was that I was getting repetitive sinus infections. So every winter, or fall really, October through about April, I was on antibiotics, and I got a cold, got an infection, antibiotics knocked it down, next cold came in. It was just kind of repetitive, and it just got old, and it was one of those things. I knew what was going on, and I mean, the other thing that's sort of the fact of the matter is I had every resource available medicine-wise, so there wasn't anything under the sun that I couldn't get my hands on, and it wasn't enough. I mean, and I knew it wasn't enough, and I knew it was just getting, time was, going on, and it was just an annoying sort of a thing.
Well, and I think that's one thing that a lot of people would say to you is, okay, you had access to all these medications, and most people think, oh, well, doctors jump to these, surgeries too quick, but you yourself have said, you tried all the medications, you tried all the things that you could do because you had them right at your fingertips, and it was eventually that, the surgery was what was necessary. And I think a lot of people put it off like that. They try everything they can because nobody wants to have surgery.
No, absolutely.
Do you wish you would have done it sooner now?
I do and I don't. I mean, I do because it's nice to be on the back end of things. That's great. I don't because, the things that the procedures that I went through have really been sort of optimized over the last 5 or 10 years. So if I did. So when I was growing up, I broke my nose a couple times. I had surgery when I was in college, and they had to re-break my, they re-broke my nose. I had my nose packed and the splints and the whole big deal.
Me the chills.
And so, I've been there, done that. And so, it wasn't like this was the first time going through something, but so I was there, and that helped. It helped to some extent. It kind of gave me a little hint to where things could be. And then, it's one of those things I knew, doing scans on myself in the office, I knew what the deal was and knew what I thought needed to be done, and the time was right. I mean, I guess bottom line, technology was where I wanted to be, and comfort level was there as well. So.
As a doctor, I'd be a little freaked out treating another doctor, especially doctor is your kind of specialty.
Yep, absolutely. No, I know it's a little weird. It's weird. I mean, it is. It's a weird factor that's in the mix, and I try to keep it out of the mix. I mean, I really try to come in with just sort of my story and getting. I think we talked about this a little bit before we were on. Is that the hard part for me was finding somebody with the same mentality as I have as far as looking at these situations. So I'm an ENT doctor, ear, nose, and throat doctor, and there's lots of us around, and lots of varying viewpoints. My viewpoint is very specific, and I do things the way I think things ought to be done, and that's not the only way that it can be done, but it seems to be working out well for my patients, and I wanted that same sort of mindset, and that was the hard part, but I was able to find that.
Well, I was thinking about the fact that, you might be a heart surgeon, but what are the chances that you've had heart surgery, or if you're a brain surgeon, have you had brain surgery yourself? But you're really in a situation where you can identify with patients who come to you and say, I've tried medicines, I've tried this, I've tried that. But then you can also say, okay, I know what it's like to have this kind of procedure because I've had it done to myself. And I think that makes people, you know, just like you want a doctor, if you're going to have a certain procedure, you want to know that they've done a lot of that particular procedure. But you also, to have the unique experience of having a doctor who's also had those procedures, I think offers patients something unusual.
Yeah, well. Thankfully
That's
I'm not
good.
yeah, no, I agree. I mean, I think it really helps. I mean, it helps from the having those issues, and helps from going through the surgeries. And I know, you know, what it feels like to have splinting. I know what it feels like to have, you know, suction. I know all that firsthand, and so it's not. I guess I'm not exposing anybody to anything I wouldn't have gone through myself because I just did. So,
well, and one thing that, you know, speaking of things that you wouldn't have gone through unless you had them available at your fingertips too, is the mini CAT that you've done as well.
Yeah.
And you have that technology in your office.
Right.
I know you brought in some pictures to kind of show what it looks like.
Doesn't that look
this
just
is
like
you.
me?
Yeah.
That looks like you. You're wearing a mask
that's
too.
That's right. So that's the old me. So that's the pre-surgery me, and we can kind of flip over to
what
the
should
after.
we look at?
So just look how narrow things. Well.
Oh wow.
So look how open that is. Look how closed off things are. So that's my septum was bent. There's a spur that sticks out there. Those are my eyeballs there that are sticking through. But everything's just tight as far as the sinus passageways.
Okay, now
and
go to
breathing
the new one
passageways.
again.
Go to the after, and what we see is all those areas that are tight are now open. Now it doesn't seem like it's a dramatic, vast difference behind the scenes, and that's what I wanted. So anatomically, that makes a huge difference. So before what was going on, my breathing passageways were narrowed down, my sinus passageways were narrowed down, and so it was anatomy issues. We always talk about that. Anatomy issues that aren't going to go anywhere with medicines, and they weren't going anywhere. And so what I ended up doing, or having done, was having those areas open. And so now I've got, instead of an uphill battle, I've got a downhill battle as far as the sinus infection, that sort of things. As far as breathing goes, it's consistently open, and I'm not having to do much of anything to keep it that way, which is a big difference. I mean, so that's a quality of life difference on a day-to-day basis, and then on an ongoing basis through the years.
Yeah, breathing is good.
Yeah,
yeah, especially if it's easy to do. So here's how people can get in contact with you at Advent. It's Advanced Ear, Nose, and Throat Specialists. They're located on Mayfair Road in Wauwatosa. The phone number for more information is 414-771-6780 or advent.md, because there's no reason to suffer with chronic sinus problems. There's help out there and a lot of new technology too. Thank you so much.
Thanks for having me.
To the doctor and the patient.
Yeah,
we like it.
And still ahead, how to make sure people